IOP stands for Intensive Outpatient Program. What that means is typically patients will meet for about 4 appointments per week during a 6 to 8 week time period. It would be 3 group sessions and then 1 individual session. And then they'll also have medication management appointments throughout that time at whatever point the psychiatrist would recommend. So the groups really focus on a lot of DBT, dialectical behavioral therapy, and CBT, cognitive behavioral therapy modalities. And it looks really at a lot of different coping skills, different types of ways to build awareness into maybe what some of our triggers are, what are warning signs to let us know this is a good time to use a skill, or I should do something different here. I would say really the biggest piece of the program is it focuses on helping people get more of a sense of routine in their day-to-day lives and feel a bit more in control of managing what they might be experiencing. If someone's already linked with Horizon to get referred to our mental health IOP program, they just really need to have a conversation with their counselor. I'm assuming most counselors would suggest that as well if they're noticing some of the things that would make someone a good referral for this program. But once you have that discussion with your counselor, then they submit a referral. We review them every week as a team and see if someone can get linked to what our availability looks like. If someone is a member of our community and isn't a part of Horizon just yet, then they can get linked with Horizon, start the intake process, and the counselors there are also able to refer into the mental health IOP program. Someone who would be a good fit for IOP is someone that is experiencing an increase in their mental health symptoms to a point where it's probably impacting their functioning in a pretty significant way. This is a really good option for people who are feeling like normal mental health services maybe aren't fully meeting their needs. So if a once-a-week appointment doesn't sound like quite enough, this is a really good option. We typically do about 4 appointments per week when someone is in IOP, so it's a lot more flexibility and a lot more support during that time. This can also be a really good fit for someone that's kind of in that in-between stage, if they are maybe just getting out of inpatient care, or if they feel like they're on the verge of inpatient care. This can be a great step in between that. So again, they're getting more of that support and more time to focus on taking care of their mental health. Someone is able to work and attend IOP at the same time. It really just depends on the flexibility of their job. Our schedule is about 4 appointments per week, so it is a big commitment for a 6-week time frame. If their work, though, is flexible, we've had a lot of people that work while they are in the program. A nice thing is our groups are around a lunch hour, so for some people, they're able to do that on a lunch break, or depending on their hours, they might be able to work a shift before the groups, after the groups. We really try to make it as flexible as possible, and we try to work with people's employers if we're able to, and of course, if the person gives us permission to speak with them to see if any accommodations can be made. But a lot of times too, employers are flexible when they hear that this is maybe a 6 to 8 week program. They know it's for that short time frame, so they're usually willing to work with people as well. We have that conversation throughout the whole program of when would you be ready to finish with this? When does that person feel comfortable with returning to more traditional counseling services? So first of all, it's not even where you complete and then you're just done. In pretty much every case, we do recommend that someone continues with some form of counseling afterwards to continue to monitor and manage all of the progress that they've made. But I would say some of the big things we look for are whatever goals that person addressed or identified at their initial session. What were the things they really wanted to get out of this? Do they feel like they got that? And we check in very regularly throughout the program to make sure that they feel like they're making progress towards those areas. So I wouldn't say there's any specific things we look for someone to graduate, but we probably would want to see them feeling like they are more in control of managing their symptoms, how their emotions are feeling, good linkage with medications if that's the right fit for them, and just, again, feeling like they have more of a sense of routine and structure in their lives. There's really 3 big benefits we tend to see. Of course, people really gain a ton of coping skills during this program, just feel better able to manage whatever is coming up for them. I think also a lot of people find that they get more of a sense of routine and structure from the program. 4 appointments a week is a big commitment. And all of a sudden now, I have to be up at a certain time. I have to be interacting with other people. I have to be somewhere at a certain time, or even if they're doing our telehealth track, I have to be presentable to be on camera for an hour. So I think that's a really good motivator to get up and get moving for your day. And then again, I think that connection aspect is just so huge. So many people are in the program and just say, like, I didn't realize other people went through this too, and I feel so much less alone. And so that connection is, I think, probably one of the biggest benefits we see.